In this video, I will answer a question on if degenerative disc disease in the neck can get better without having to resort to surgery. Expect to learn the following. What does degenerative disc disease even mean? How can it happen without any direct injury or accident? Why starting with surgery right away could cause more problems, and how our providers go about addressing the issue without surgery. For those of you who don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert. My focus is on diagnosing and treating adhesion, also known as scar tissue, and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick reminder, if you're dealing with chronic pain from an injury and you're struggling to get some real answers as to what is going on, you can submit your questions directly to me. And if my insights can help, I'll be sure to get a video out to you. The question this week came from Ashley on Instagram. Let me read it. It says, I'm 42 and have been dealing with chronic neck stiffness and pain that has gotten worse over the past year. I recently got an MRI of my neck and it came back that I have degenerative disc disease, which scares me. Aren't I too young for that? Plus, I've never had any direct injuries to my neck or accidents, so how did this happen? The doctor wants to do a disc replacement surgery, as he said the disc is too far gone, but the idea of getting surgery on my neck is terrifying. Everything I've read online says there is nothing to do for this and that surgery is the only option. Is that really the case? Thank you so much for sending that in, Ashley, and I'm sorry to hear you're dealing with this, but there are other options besides just surgery. You have to understand surgeons do surgery and they're going to recommend it no matter what. So what does degenerative disc disease even mean? It's just means the disc started to wear out. Basically, when I look at degeneration, it just means that things got older before their time. But what happens with a lot of people is they get labeled with certain types of diagnoses and they go, well, I just have degenerative disc disease. There's nothing that I can do. And it puts you in like a victim mentality and keeps you from taking action. It's like, oh, nothing I can do except for have surgery. That's it. And you become very closed-minded and think that's all you can do. And unfortunately, that's what the medical system does as well. I read this really awesome book about 2 years ago. I forgot what it was. I think it was called like Back to Normal, but it was written by an orthopedic surgeon who specifically did spine surgery, especially around the discs. And what he started to see was he was doing all these surgeries on people and they weren't getting better. And he started to realize there was other factors involved, like their diet, their stress, bad tissue around the area, all sorts of things. And a lot of times the disc itself wasn't actually the problem, but because we see it on MRI, we automatically assume it must be the problem. There's really two sides to this camp out there in the medical treatment world. There's one side that says only your MRI tells you everything. They rely solely just off MRIs. A lot of these are orthopedic surgeons and things like that, where they say, hey, there it is. Your disc is degenerated. You have degenerative disc disease. You need surgery. There's another faction of providers on the other side that say your MRI doesn't matter at all, that everyone has some form of degeneration. It's just normal and it's not actually the pain generator. Actually, they're both wrong. It's somewhere in the middle. Yes, the disc is a problem and the pain you're having can be caused by that, but a lot of times it's not the main problem. So it's somewhere in the middle. So how can it happen without any direct injury or, trauma or accident? This is what Ashley was saying. She's like, how the heck did this happen? I haven't had any accidents or trauma or injuries. Basically, what happens over time is everything around the discs and the joints develops this stuff called adhesion. I talk about it all the time. Adhesion is like glue. It's also known as scar tissue that gets inside. It really starts in the ligaments, especially in the neck. The job of the ligaments is to provide some stability and movement in there. And then when we have bad postures, looking down too much, sitting at a computer, staring at our phones, those ligaments get stretched out. And when they get stretched out, they don't get enough blood flow. They don't get enough oxygen. The brain actually thinks there's an injury there. So it starts to lay down this adhesion and it makes the ligament less flexible and weaker. Now the ligament can't do its job. So it puts more wear and tear on the muscles, and the muscles have to start to do more as well. They then develop all that adhesion. They get weaker, less flexible. And then eventually what happens is you have all these nerves in the neck that start at the base of the skull, go all the way through. They got to make their way to different muscles in the body. They get stuck as well and form what's called a nerve entrapment. And when that gets bad, it puts a lot of pressure on the area. So now the ligaments jammed up with adhesion, the muscles, the nerves get stuck. So the force has to go somewhere. So where it ends up going is it goes to the discs and the joints. And then that's where this degenerative disc disease just kind of came out of nowhere. So why starting with surgery right away could actually cause more problems. So much of the medical system is focused on what I call the effect and not the cause. Like the disc looks bad on MRI. So the surgeon says, hey, you got bad discs, we got to go in there and fix it. But the problem is, as I said earlier, all that adhesion, all that bad muscle, all that inflammation built up in there and around there, and it put more pressure on the area and cause that effect. The disc is the effect, it's not the true cause. I always say to my patients is, think of your discs in your joints that are degenerated as like your thumb and it's stuck inside a car door. The car door is all of that adhesion. We can't give this a chance to heal up until we remove it. So a lot of times when people go in and have surgery to fix the disc, it's like they pulled the door off real quick and took it out, but then eventually that door is going to slam right back there again. This is why they have codes out there called failed neck surgery, failed back surgery, because they're going in, going after the effect, but not getting to the true cause. So, how do our providers go about addressing the issue without surgery? First is we need to unload the disc. That comes with treating the adhesion around there. We treat the adhesion in the ligaments, we treat the adhesion in the muscles, and we treat the adhesions in the nerves with our hands as well. We take a very detailed and focused approach where we're able to get proper depth and tension on those areas and break that down as the client goes through a range of motion. That breaks it down, restores blood flow to the area, gets all that inflammation out there, gets it functioning better, more flexibility, takes some of that pain away. Then we also reduce inflammation through lifestyle modifications. A lot of things we do with some dietary involvement, helping you learn how to breathe better, manage some stress. And sometimes we even bring in some supplementation as well if we need to really kick that inflammation down. And then last thing is we build up the strength in the middle of the back and the neck as well, because your neck actually has a core very similar to your lower body. And a lot of these muscles in the front of the neck, they just get very weak with all that adhesion, all that stuff building up. So we get all of that out of there. Then we need to build that strength up as well and take all the pressure off of there. So first we got to unload the disc, then reduce the inflammation, then build up the strength. And a lot of times people try to skip steps on there, and a lot of providers do as well. Maybe they might try to get rid of some of the inflammation with some medication or some type of injection, and then they might go to PT and get some muscle buildup and things like that, but they never actually address the real problem, which is the adhesion. You got to go in order, you got to break it down. So basically, best case in anyone that has this problem, especially someone like Ashley that sent this question in, best case scenario is follow the process that we say. It's safer, it's more effective, it's durable, there's not a lot of risks associated with it. And best case is you don't have to have surgery at all. You do great. Worst case scenario is you still end up having to have surgery, but you cleaned up all the tissue around there. It's going to make the rehab much better, cut that in half. So a lot of people just want to jump right into getting the surgery right away because it doesn't involve a lot of effort on their part as the patient, but there's a lot more risk and side effects and just chances that it's not going to work out right. But no matter what, you have to address the adhesion first, because if you don't, like I said, that car door is going to slam right back down on that thumb, and you're going to have to deal with that problem all over again, and it's going to be a lot worse. So that's all I got for you in the video. If you've been dealing with a chronic neck pain from an injury for, I'd say, at least 6 months, seen way too many providers, still having issues, considering surgery, then reach out directly to us and set up an injury consultation to get some real answers as to what's going on and just get yourself on the path to long-lasting pain relief so you can stay away from pain pills, injections, and surgeries that only make things worse. All the information to request a consultation is wherever you're consuming this video. I appreciate you watching, and we'll catch you on the next one. Bye.